If you don't believe in aftercare after a big body contouring operation, you kind of don't care about the safety of your patient. So here is the deal. We do some really big, really transformative operations on our patients. I mean, these are huge things that are safe, they're controlled. I mean, think about all the stuff that I do before anyone even steps foot in the operating room. We have them checked by their doctors. We have them checked for labs. Medications are set. Nutrition is set. All this stuff is really carefully controlled. I do an operation where I'm not only super focused on giving you this incredible result after surgery, but through the whole time, I'm worried about your blood pressure, I'm worried about your vital signs, I'm worried about fluid balance. All this stuff matters. So if I finish an operation and then suddenly say, hey, vaya con Dios, good luck, I'm an idiot, because surgery does not end when you leave the operating room. Your recovery is as important as anything I do in the operating room. And here's the deal. After surgery, your body is still going in a way that is not its normal day-to-day thing. Your heart is working. Your body has a total change in its fluid composition and all this stuff. There's a massive amount of inflammation and response to the hours of surgery that we just went in. And your body is going to react differently than it would the night before surgery. So what we do after a situation like this with our bigger surgeries is we have our patients go to an aftercare facility. In Beverly Hills, there are a ton of these different groups where there are nurses who are specialized in caring for plastic surgery patients specifically, and they take residence in various hotels or other places that are actually dedicated to taking care of you, and they are there to care for you. They're there to monitor you. So they'll do frequent vital sign checks. They will make sure that you're properly hydrated, that you're peeing enough, that you're walking, and that your pain is under good control. These are things where it's not just me counting on some partner or spouse of a patient who may be even queasy at looking at this. I have an expert following you during your recovery. But the key thing is that, God forbid, if something isn't perfect, we now have someone who will recognize it and will be able to act on it appropriately. And that may be something as simple as keeping you more comfortable or motivating you to walk, or they will call me. They know what to call me for. Or in serious cases, they can actually say, hey, listen, we need to step this up and we need to go to the emergency room. We need another intervention. So this is all for your safety. I will absolutely say that in the vast majority of my post-operative situations, the recovery people are there just for your comfort. And listen, that's really important. But there have been moments where my recovery nurses have literally saved a patient's life because they were looking, because they were doing their job, and they were caring for you. So, does aftercare matter after a big operation? You bet your ass it does, and I will put your safety before anything whenever I do an operation.